So we're here to do a 1 hour workshop style interactive session to teach you about the idea of S.B.A.R. It stands for S for situation, B for background, A for assessment and R for recommendation. And it's about making us more effective in our communication. What you can use S.B.A.R for is in handover. When district nurses meet, they often go out and do their visits in the morning, come back at lunchtime, make sure everybody's okay, and then they want to talk about what's happened, have a clinical discussion within a group. So in the handover, it can be very lengthy. You can get into discussions about non-clinical issues that you don't need to discuss. S.B.A.R allows us to have that framework to keep us focused on our clinical discussions, get right down to the point and take out all the waffle and the conversational part of the handover. So it brings you right down to the nub of the problem and allows you to stay focused on the clinical needs of that patient and what you need the rest of the team to know. So for example, I come back from my morning visit and I say, I want to talk about Mr. Smith. Actually, everything's changed. The situation we all know is that he lives alone and he's got leg ulcers. The background is we've been visiting him for the last 2 weeks and this new dressing has not been working. My assessment is actually that he's brewing an infection. There's a lot of redness around the outside. So my recommendation is that I ring the GP and ask for some antibiotics because actually systemically he's unwell.
Hello, Abingdon District Nurses.
The idea is that once clinicians have got used to S.B.A.R as a framework or as a tool, they can then use that in any type of communication.
What is the actual situation that we have with the patient?
They can use it on the phone when taking a message or talking to another clinician on the phone. They can particularly use it talking to a GP face to face. The clinicians can also use it to do their progress notes on Rio, and any other clinician following on, whether it's a physio or an OT or the podiatrist, can see actually what you found, what your recommendation was and what you've done about it. So it makes all the communication more effective. That's the idea behind it anyway. Then we introduced the idea of a patient status at a glance board, which is another type of tool to help support S.B.A.R and support the teams work more effectively. What we've found is that when people have used it in handover, they have been able to cut down their handover time from an hour or over an hour down to half an hour. Now that means that you're saving half an hour per clinician per day across the week, which is a lot of hours. And the benefit of that has been that because they've had a quicker handover, they've been able to have more time to do their Rio notes, or they've got more time to spend with their patients rather than time talking to other people about their patients. We've had really good feedback that actually it's something that you can pick up quite easily. It's straightforward, you know, it does what it says on the tin, literally, S.B.A.R, and you can input it straight into your own personal practice to make changes quite quickly.
Yes, I'm going to try and use what I've learned today in practice to see how it's going to help me and my team.
Every minute we can save, from the handover or from reporting is one more thing we can do or one more visit we can do to a patient.